Hi, my name's Dr. Luke Smith, chiropractor and functional medicine practitioner. Does your child have trouble with their breastfeeding habits? Recently, a colleague and friend of mine, Dr. Adam Stewart, published a study in the Chiropractic Journal of Australia that looked at breastfeeding and chiropractic. Now, the way he looked at it was through 19 patients who'd arrived at his clinic, all of whom had the complaint of breastfeeding issues, one after the next. Now, what he found, to summarise, was that 100% of these kids improved their breastfeeding habits, which is just extraordinary. 100%. Now, 19 out of 19 of them improved their attachment onto the breast, which is often the main issue. Once they attach, they'll feed a lot more easily, obviously. 94% of these kids improved a condition where they'd arch their head while they were feeding and throw off the breast or arch their back. And 88% of these kids stopped doing something we call side shaking. Now, side shaking where they'll be feeding and they'll throw themselves off the breast like this. So quite extraordinary. 100% improved, and all those large numbers for the specific things that may cause difficulty breastfeeding. So how does this work? How does this work? So what Dr. Stewart found, and what I've also found through seeing many kids who had this same type of complaint, is that they often have a condition called subluxation of the upper cervical spine. Now, subluxation is where the joints of the top of the neck misalign, perhaps due to the trauma of being born, where the head might be twisted and pulled and turned. And what this does is can cause an uncomfortable sensation when the child's trying to turn their head, or also when they're trying to hold their head in a certain position that might be necessary to feed. So the other thing that can happen from a subluxation is it can interfere with the delicate nerve fibres that come out of the spine, and even the brain stem around the top of the spine where those subluxations occur. Now, if this happens, it may interfere with things like the ability to swallow properly or suck strongly or even to attach. So chiropractic care was able to help by improving the function of the nerves and also improving the comfort level of the child while they were feeding. So chiropractic care and a chiropractic adjustment might be that simple to get your child to feed more easily. So just remember, creating health is a choice that you make.